Hello viewer, welcome to the first edition of FUTH Lafia series on what you need to know. Today, we will be discussing on the operational protocols in the radiology department. It entails the procedures and standards that ensure safe, efficient, smooth and quality imaging services of patients at our hospital. Joining you to do justice to that is Dr. Mohammed Amin Badamasi, the Chief Resident in the Radiology Department.
Yeah, I'm Dr. Mohammed Amin Badamasi, the Chief Resident of Radiology Department. I'm representing the Head of Department of Radiology Department. Yeah, when the patient arrives at Radiology Department, they are warmly welcomed by the front desk. So at the front desk, we have our receptions who welcome any patient that is coming and attend to them promptly. Majority of these patients, they either come in with a request, or their requests are sent via the EMR. So it will be actually looked into, and they will be assigned as either inpatient or outpatient. Those that are also emergency, from any emergency point, will be given priority to and will be attended to almost immediately, except if there are instructions that will be given. Example, let's say we have somebody that need a prostate scan without a filled bladder or with a catheter already inserted. So the patient will be given some instructions. Or if we have, let's say, the doctor is thinking, the requesting physician is actually thinking of a gallbladder pathology, then the patient may be requested to fast for 8 hours. So basically, all patients that comes are warmly they are warmly accepted, and their requests followed promptly. We actually one of the protocol of the department is to expose patients to less or low radiation, as low as reasonable possible. So these are the decisions we take. Then when the patient comes, we try as much as possible to practice what we call ALARA, so as low as reasonable possible for patient to be exposed to radiation. Yeah, you know, radiology department is a multi-billion naira department. Maintaining the equipment regularly will not let majority of the equipment to break down and for us to stop our operation. Accepting patients with care, warmth and empathy, that is one. Majority of our staff are actually putting in their best, coming early to attend to patients, and as well suggesting to patients exactly what to do if there are some technical problem. Let's say for instance, the patient that makes payment and the payment is still showing payment pending. Most times the staff, you see, they are the one working around the clock to ensure that ICT and accounts department actually clear the patient. Even on reporting, you will see they abandon sending or transmitting the results via the normal EMR temporarily, so as to just give the patient a better experience in order not to be moving up and down within the hospital. For patient visiting the radiology department, every one of us in radiology department is actually working towards helping them. The only thing is we have a lot of patients coming from various parts of the hospital. The watchword for our department is patience. As you follow the queue gradually, as we are clearing, then everybody gets home as fast as possible. We know most Nigerians want to jump queues, but we try as much as possible to use our own protocol to guide patients on how to have access to us and to have access to our services, so that they can go back to their ward or go back home as soon as they can. Thank you.
Thank you, Dr. Muhammad, for sharing these valuable insights on the operational protocols in the radiology department. And thanks to our viewer for joining us. Stay informed, stay healthy, and sure to follow instructions whenever you visit the radiology department. See you next in What You Need to Know as you visit Federal University Teaching Hospital, Lafia. I am Kufre Abasi Umana from Information and Public Relations Department, FUTH Lafia. Thank you.